When the Presidential Task Force on COVID-19 announced the first phase of the eased lockdown in May this year, it came with so much responsibilities that citizens are expected to adhere to. Some of these responsibilities include regular hand washing, the use of alcohol-based sanitizers, and the mandatory use of face masks in public places. To ensure compliance, some states, including the FCT, set up special task forces to enforce these requirements. Mobile courts were set up in some cases to try defaulters. 3 months down the line, the level of compliance with these protocols remain very low.
The majority of Nigerians, irrespective of status, creed, and level of education, continue to live in denial on the virulent nature of the virus and consistently breach the guidelines and non-pharmaceutical measures put in place.
On the streets of Abuja, Nigeria's Federal Capital Territory, some citizens share with us their views regarding the existence of COVID-19 as well as the safety protocols.
I use when I'm compelled to use. I want to enter a bank, you say I must use. Because I want to enter the bank and leave, I will use it. I use it when I want to enter offices, and anywhere I'm not so convinced, I will use, because the law said we should use it.
I also know 1 or 2 persons who, in their places of work, 1 or 2 people who are contacted. So because I want to be safe, and that is why I'm wearing the nose mask. You see, this mentality of Africa, sometimes somebody just believes in God and said, I just believe that nothing will happen, without taking a major prevention. So prevention is very, very good. Yes, we believe in God. We have faith in God. You understand? But the issue is that we should also know that there is a need for us to take precaution.
I'm using face masks in order to, to prevent myself. It's just to prevent, you understand? Either it exists or not. I still have to prevent myself.
Currently, there is neither a vaccine nor a single cure for COVID-19, as healthcare practitioners say they continue to work on boosting the immune system of patients and treat their symptoms as they manifest. The only known proven prevention, they say, remains the use of non-pharmaceutical interventions such as the use of face masks, constant hand washing, as well as maintaining proper respiratory hygiene.
And now, to discuss the issue of adherence to the COVID-19 protocols, we're joined on the news at 10 by the National Coordinator of the PTF on COVID-19, Dr. Sani Aliyu. You're welcome to the news at 10.
Good evening.
Good evening to you, sir. How worried are you about the issue of poor compliance to the COVID-19 protocols across the country?
Well, we remain quite concerned about the level of compliance. Just today, this afternoon, I went out in Abuja, and I was quite concerned about the degree of compliance, including in places that really should know better, places that provide business to the general public. There was very little enforcement. But we know that this is all about behavioral change. Nigeria is not the only country where we are facing this sort of issue. Globally, across the world, we are seeing the same pattern. The COVID pandemic is an unusual one because it's not behaving like a normal pandemic. With a normal pandemic, you have the shock factor where you see a lot of people dying, dead bodies on the streets, or people bleeding to death. Sort of a really shocking pictures that force people to change their behavior. Whereas with COVID, we know that the majority of people would suffer the infection, but will still get better. So what we are doing is we're trying to change the narrative. Rather than saying, look, if COVID catches you, you may die, which of course you may, but it's really a case of trying to protect your loved ones, trying to protect your parents, your neighbors, people that are elderly, people that are vulnerable, people that are most likely to die. In addition to this, you really cannot predict if you get COVID, whether or not you're going to be alive. The youngest person to die in the FCT, for instance, was just 38 years old. So it's like playing Russian roulette. In Nigeria, about 18% of those above the age of 65 died from COVID. That's a pretty high mortality rate. It's almost a 1 in 6. Out of one in every 6 persons would die. But we know the challenges with behavioral change. We know that the COVID pandemic has been with us for quite a while. People have become really fatigued and tired of the issue. People don't want to wear masks because this is an invisible enemy. You don't really see it when you go out. It's a silent enemy that definitely kills. But we have to persevere. And one of the things that also concerns us is the perception that this thing is over. One of the reasons why we've been relaxing the restrictions is in order to get our economy up and moving. But the public need to realize that unless we take these non-pharmaceutical interventions seriously, it's the only thing that would slow down and stop the pandemic fairly early on. If we don't, and the pandemic continues to grumble, then we will all suffer for it. Not only people will die, but our economy will take a much longer time to recover. Because as government, we cannot just sit back and allow people to catch a preventable disease and end up dying. We will end up placing more restrictions. So as I said to the person I met today when I went out in Abuja, if you really want this to be over, you've got to try and keep to those non-pharmaceutical interventions, wear a mask, keep social distance.
And we hope those suggestions, those protocols are followed to the letter. Dr. Sani Aliu, the National Coordinator of the PTF on COVID-19. But as far as compliance goes, Dr. Aliu, a lot has been said in the way of enforcement. What more do you think can the government do to reverse the trend of lack of compliance?
So we know that with behavioral change, what works most is convincing people that they are at risk. In other words, effective risk communication and engaging the community. Not only improving the message that we are pushing out, but also changing the messengers themselves. So engaging with traditional rulers, religious authorities, and making sure we have their support in pushing the message out. Obviously, the media have a major role. We have been working very closely right down to the grassroots level in terms of mobilization. Even as we speak in 17 states, we have over 18,000 volunteers that are going house to house and providing information. We have motorized campaigns. We have campaigns that involve face mask training with market women. And as you can see with the social media, there's a major campaign as well that has been going on for the last 1 week. But it's all about making people aware that if you don't wear a mask, if you do not take care, if you go out into the general public without any sort of protection, you're very likely to catch the illness. And if you catch the illness, we just cannot say whether you will fall in that 80-90% of people who would survive it, or you will fall within the minority that wouldn't. And I'm sure none of us want to be carried away by COVID, because COVID will go away, but it will carry away a lot of people with it. Already we can see the sort of deaths that have happened in other parts of the world. Nigeria is not an isolated case. As we have about 1,000 people that have died from COVID, but I'm sure we have had a lot more that we haven't measured. And again, I'll emphasize that the numbers we are seeing now are an underestimate of what we've actually had, because our testing rates are still relatively low. Our general capacity for testing on a daily basis is about 10,000 tests a day, but we're only testing between 2,000 to 3,000 per day, partly because we are not getting the sort of demand we expect. We've increased the number of laboratories to 62, but a lot of these labs are operating way, way below capacity. So we will continue to encourage the state governments in particular and our community leaders to please take up the fight, and together we can fight this and we can win. But the general public need to be aware this infection is still very much around. It is still killing people, and we need to take care.
Yes, indeed, and we hope that awareness leads to action on both sides, the people and the government as well. Thank you so much, Dr. Sani Aliu, the National Coordinator of the Presidential Task Force on COVID-19, for speaking with us.
Thank you for having me.